Good morning and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, back for another show today, and we're getting ready to get physical. And by physical, I mean learning how to best manage our blood pressure and cholesterol. Healthy blood pressure and cholesterol numbers are usually a good indicator of a healthy lifestyle. Let's get started. With me this morning is Dr. Bethany Barone Gibbs, Associate Professor of Health and Human Development at the University of Pittsburgh. Dr. Gibbs, welcome.
Thanks so much for having me. My pleasure to be here.
Absolutely. I've been waiting to work out until after we had this conversation. So let's move on and get started with Health in the Headlines, my favorite segment. Good health is always newsworthy, so each week we select a current headline that ties back to the topic at hand, and we bring it back to the table, and we ask our expert to respond. This week's entry comes to us from our own AHA newsroom, and it's titled Prescription to Sit Less, Move More, Advice from Mildly High Blood Pressure and Cholesterol. Dr. Gibbs, I believe you had something to do with this study. What can you share with us?
Sure. Well, I serve on the Committee for Physical Activity for the American Heart Association, and our committee is all about trying to take research and disseminate it to clinicians and also the general public so that you can understand what's the best way to increase your physical activity and improve your heart health. So our committee decided, since over the last couple of years, some new guidelines from American Heart Association, but also American College of Cardiology and other organizations have come out with kind of new guidelines for treating high blood pressure as well as high cholesterol. And a really cool thing about these guidelines that was sort of a central theme we picked up on was that treating lifestyle, using lifestyle as medicine is really important to do right away. So sort of that intersection of all these different guidelines toting lifestyle was really why we wanted to do a statement just about this. And we want to not think about this as just something that exercisers do, not just something that, crazy people that go to the gym for 3 hours every day do. This is really something you can work into your everyday. And also it doesn't have to be for an hour. We know that even a few minutes a day can give benefits, especially for people who are inactive. So the purpose of this statement was really to talk about what are the recommendations, how do they work with other lifestyle characteristics, who should be doing this, and what kind of effects can we expect?
So in other words, I have no excuse. I have to get active here pretty soon.
Yes, yeah. As soon as we're done, you're going to go do it.
Absolutely. Thank you for that. Let's get into our main segment and answer viewer questions. We call this segment You Ask, We Answer. Doctor, our first question comes to us from Adrian in Temple, Texas. Adrian is saying this: if I have high blood pressure or cholesterol, should I first be treated with lifestyle modifications?
I am so glad we're starting off with this question. So the first answer is that absolutely everybody, no matter what your blood pressure and cholesterol is, should be doing exercise in order to improve those levels. So for people that have healthy levels already, you should be doing exercise to prevent getting high blood pressure and cholesterol. We call that primordial prevention before you even have a risk factor. For people that have severely elevated blood pressure or cholesterol or have other cardiovascular risk factors like diabetes or pre-existing cardiovascular disease, you should absolutely also be doing exercise. This can help your heart health, but you probably also need to be treated with medication or some other treatment. What this statement was really highlighting, and relative to this question of should I first be treated with exercise, there's this in-between group, right? This group that doesn't have a lot of other cardiovascular risks and is just starting to have elevated blood pressure or cholesterol, maybe for the first time or just for a couple of months, or they're only mildly elevated. And this is the group that should be treated first with lifestyle modifications. So hopefully, so you can get your numbers back to that primordial prevention below the risk levels. So there's lots of lifestyle options, and you can do more than one. The more you do, the better. So we know that to be true. And physical activity is a really potent one that affects both blood pressure and cholesterol.
Absolutely. Walter from Oxford, Mississippi sent us this question. Should I quit smoking to help improve my blood pressure?
This is another great question. So as I mentioned, all of these lifestyle modifications can work together. Actually, surprisingly, quitting smoking is not one of the main strategies used to change blood pressure, sort of day-to-day blood pressure. But we do know that quitting smoking really protects you from long-term risk of cardiovascular disease, which of course is the reason we keep our blood pressure low. So certainly, quitting smoking is recommended for cardiovascular health. Do we expect that to make a big change on your numbers, a week later? It's kind of complex because we know that quitting smoking also has some other effects that might work together, like maybe weight gain or increased stress. But all of those things you should work with your doctor toward the goal of decreasing smoking for sure.
Absolutely. Thank you, doctor. What about this one from Camille in Denver? What physical activity should I be doing to treat my high blood pressure or cholesterol?
So this is a great question. The first answer I like to give is the physical activity that you like doing, that you will keep doing, because that's the number one important thing, to keep regular physical activity as part of your life every single day. It's really exciting. The newest physical activity guidelines that came out in 2018 sort of stress the importance of every minute of physical activity counting. So even, parking a little farther away and walking into the store, even taking your dog out for a quick walk or doing like a dance break in your office, any of those things are going to count toward your physical activity. There's all kinds of different physical activity, and find something you like that you can sustain. So, do you like yoga? Do you like, brisk walking is my number one go-to because it's just so easy. I don't have to change my clothes. If it's the end of the day and I haven't had enough steps, I look down, I just go take a couple laps around my neighborhood just to get it in. If you like weightlifting or resistance training, that's great. So any of those things are actually all going to have the effects on blood pressure. It's really about elevating your heart rate and, kind of breaking up sitting and moving more often.
Great recommendations, doctor. I'm actually going to see if the studio team will exercise with me right after the show, right here in the building.
That's great.
Jamie from Illinois is asking us, how much will physical activity improve my BP or cholesterol?
So these are really great questions. And the first thing, and we go over this in the statement, is that there's really variable effects. And it depends how much you do and what kind of exercise you do. So, and I understand that everyone wants an answer. But, if we are exercising at the recommended levels, which is at least 150 minutes a week of moderate intensity exercise, which is like brisk walking. So that's roughly 20 or 30 minutes a day if you want to space it out over the whole week. We can expect a decrease in blood pressure of somewhere between, 2 to 10 millimeters of mercury. It also kind of depends where you start. If you start higher, you're more likely to go down more. If you're already healthy, you might not expect a big decrease, or you might even just be able to stay where you are. But that's still great because you're not moving into that elevated range.
Here's one from Marta in Palo Alto. Does drinking alcohol have an effect on my risk of heart disease or blood pressure?
So this is another great question, and it's a little bit nuanced. I'm sure, a lot of people have heard, a glass of wine a night is maybe cardioprotective, and the epidemiologic evidence really does suggest that 1 or 2 drinks a day is probably okay, and even is related to a decreased risk of mortality. Similarly, is related to a decrease in cholesterol and a decrease in blood pressure. So 1 or 2 drinks a day looks like it's okay, although really if you're not drinking, it's not recommended that you start because there are other risks associated. If you're drinking more, 3 or more sort of drinks a day, or you're drinking a lot at one time, we call that binge drinking. Those things are associated with elevated blood pressure, and elevated risk of cardiovascular disease. So it's sort of like that Goldilocks thing, right? Not too much, not too little, somewhere right in the middle. In moderation is probably the healthiest.
Absolutely. This is a good one from Eric in West Virginia. He wonders, how much will weight loss improve my numbers?
So weight loss and, how much weight to lose, most of the guidelines are looking at a modest weight loss of 5 to 10%. So if you reach that kind of level, we can expect similar effects to what we see with physical activity. So maybe a 4 or 5 millimeter of mercury decrease in your blood pressure, which is awesome. There's also tons of other benefits for losing weight. You're going to feel better, have more energy. And what's really cool is that weight loss works really well with exercise, so they can work together. Exercising can help you maintain weight loss. Also, losing weight can take pressure off your joints and give you more energy for physical activity. So a lot of people pursue those two lifestyle changes together, and that's a great recommendation if you're up for it to improve your cardiovascular health.
We've got just a few more in the queue, Doctor. Denise in Birmingham, Alabama wants to know, should I change my diet to improve my blood pressure? What about my cholesterol?
Yes, so absolutely. Even separately from weight loss, changing the composition of your diet can really improve your blood pressure. What's typically recommended are what we call a DASH style diet, which really is reducing sodium, diet heavy in fruits and vegetables, lower in red meat, heavy in whole grains. Similarly, a Mediterranean diet has often been associated with an improvement. So that's, stressing vegetable oils, fish, along with fruits and vegetables and whole grains. So kind of moving toward a diet composition with less processed foods, less red meat, less saturated fat, and toward that, sort of healthier eating pattern can definitely lower your blood pressure. Again, by this similar modest, sort of 3, 4, 5 millimeters of mercury.
Sounds like I need to get my diet in check as well.
Doctor,
you are pulling me together today. And finally, our last question comes to us from Lester. What ideas or resources are there for increasing physical activity? Great question, Lester.
I do love this question. I actually jotted down a couple of notes because I wanna help people, and I want it to be not scary. I think a lot of people who aren't active just feel like it's totally overwhelming and don't want to get started. And that is just wrong. You can do it, and it shouldn't be terribly difficult. And in fact, we know that physical activity is sustained best over time when it's something easy that you like, that's easily incorporated into your day. Also, as motivation, the people who get the steepest benefit, like incline, and the people that accumulate benefits most quickly are people that go from nothing to just a little something. So even adding 1,000 steps per day or 30 minutes per week, you can realize real health benefits. So please, if you're not exercising now, just think about trying to get a little more active. You're going to feel so good that you're going to want to do more. So, my number one recommendation, as I've already said, is brisk walking. Just get outside and it can be 10 minutes, it can be 5 minutes, walk with your kids, walk with your dog, walk with your friends or your coworkers, find social support. Use an activity tracker. I know lots of people out there have a Fitbit or an Apple Watch, or your phone tracks your steps. Set goals for yourself. Self-monitoring, we know, really helps people over time and can really motivate you. Also, there haven't been tons of great things about COVID, but one thing that's been great is the online resources for physical activity have just gone through the roof. A lot of people have barriers of time to physical activity. I myself love to do yoga, but when everything shut down, all the studios that I like to go to all went online, and now I don't have to travel. I can just do it right from my own home. So I think there's a lot of new resources, which is awesome. So if you like a certain type of exercise, find a great class that you love, that you enjoy doing, and kind of plug in. And the last thing is, you don't have to put on, an exercise outfit and get in front of people. Go out and hike, go out and get on your bike, walk to your neighbor's house instead of driving if it's less than 10 minutes. There's so many ways to build physical activity into your life, and just kind of have that idea that you're going to build it in across the day.
So no excuses, doctor. We
That's right.
have to get started
You have to do it.
somewhere.
You have to do it.
Absolutely. Dr. Gibbs, thank you so much for updating us on blood pressure and cholesterol management. You've really helped so many people, including myself. Is there anything else you'd like to add before leaving us today?
No, just that, there's so many benefits to moving more, sitting less, and every little bit counts. So just even if you're not active now, little changes, and try to make it part of your day every day for heart health.
Absolutely. Let's make a pledge, people, to get physical. That does it for our show today. You can find any of our previous shows by visiting the AHA's House Calls YouTube playlist. Join us next week for an update on COVID-19. We'll discuss vaccinations, new variants, and getting back to normal. In the meantime, take care of yourselves and follow Dr. Gibbs' advice. Get up off the couch and move just a little bit more. We'll see you next time.
All right, grab a chair or ottoman, a poof, or is it puff? Doesn't matter. Something stable you can dip with. All right, 1 dip, 2, 3, 4, nice, 5. Starting to feel it? Because I am. And I'm just an animation. Burning. Go ahead. We earned it.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.